We are in the pre-med area, the pre-operative area, and we have a patient with us who has traveled from very far from Jammu and Kashmir, and he's come to us with complaints of a protruding mandible or a forwardly placed lower jaw. And if he looks to the side, on the lateral aspect, in the lateral view, you'll be able to appreciate the prognathism of the mandible. He has a skeletal class 3. So what we plan to do is we are going to take his upper jaw forward. We are going to do a maxillary advancement and a bilateral sagittal split osteotomy with setback. So the advancement in the upper jaw is going to be about 4 mm, and in relation to the upper jaw, the lower jaw will be accordingly. According to the occlusion, we have made splint, we have performed the mock surgery, and it's going to be moved according to the maxillary arch. Alright, so this procedure should take us anywhere about 2 hours, and we will show you the post-op results shortly. Thank you.
Surgery for this patient. You can see the lower jaw sticking out. He's got underbite as well. So we've planned osteotomy on the upper jaw and also the lower jaw. We're getting the upper jaw forward by 4 millimeters to 5 millimeters. We're getting it downwards also by 3 to 4 millimeters. We made 2 splints, and we're getting the lower jaw behind, more by rotation and less by bodily movement. So this is going to change the middle third and the lower third of the face for this patient. We've given a submental intubation, and this is just before we start. Okay. Surgery, like a face makeover, both the jaws. The upper jaw has been moved forwards and downwards, and the lower jaw has been rotated more towards the left, slided onto the right, and this is what we've got. His face was a little bit longer too. We've improved that as well, and we're going to show you the different views. First, we're going to start with the side view. This is the improvement with a bi-jaw. We've made the face very much more proportional. We've taken him up a few rungs in the facial aesthetics of beauty. Now we're going to show you the front. Light karo. Okay, so a little bit of occlusal coronoplastic, little bit, minimal, hardly anything. Very good. So how is अभी दर्द कितना है आपका?
थोड़ा है यहाँ से, और swallow करने पे यहाँ पे लगता है
वो सही हो जाएगा। अभी तो फिलहाल आपका 4 दिन ही हुआ है ना? 4 दिन में तो बहुत अच्छा है, मतलब बाई जॉ सर्जरी 4 दिन लोग विश्वास नहीं करेंगे, लग रहा है 1 महीना हो गया। शो मी द प्री-ऑप फॉर हिम। सो ये बाई जॉ सर्जरी मतलब इनके ऊपर वाली जॉ है पूरी बाहर लेके आए हम लोग, थोड़े नीचे भी लेके आए, और जो लोअर जॉ है इसको रोटेट करके ये साइड ऊपर गई है, ये साइड नीचे गई है, तो दैट इज़ वाई इट्स कॉल्ड बाई जॉ। ये अभी सूजन है, सूजन पूरा निकलेगा। आप जरा मुँह खोलिए, बंद करो, फिर भी देखो बाई जॉ के बाद 4 दिन में ये मुंह खोल सकते हैं। ओपन करो। आपको कितना दिन बहुत दर्द था?
पहले
एक दिन काफ़ी दर्द था। अभी बिल्कुल दर्द नहीं है?
अभी थोड़ा है यहाँ पे, पेन किलर से ठीक है।
अच्छा, बट मेजर पेन किलर के बाद दर्द कुछ नहीं है। तो वी डन अ बाई जॉ, अपर लोअर जॉ सर्जरी, एंड यू कैन सी दैट इम्प्रूवमेंट। ये आपका रिजल्ट बहुत अच्छा है, और हीलिंग भी काफ़ी अच्छा है, मतलब 4 दिन में आप 2 दिन के बाद जा सकते हो। 6th डे ये आपका डायनाप्लासन निकालेंगे, स्कैन निकालेंगे, अंदर कितना प्लेट्स है, कितना स्क्रूज है, सब आपको स्क्रू में स्कैन में दिखेगा। यहाँ पे है, 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 यहाँ पे है। तो 6 प्लेट्स हैं और 24 स्क्रूज हैं। हाँ काफ़ी है, तो कुछ नहीं करेगा ये स्क्रूज अपने आप वहीं रहेंगे और ज़िंदगी भर वहाँ रहेगा। टाइटेनियम यूज़ किया हमने, बेस्ट क्वालिटी, कोई दिक्कत नहीं आने वाली आपको इससे। हमारे डेंटल डॉक्टर कल थोड़ा फाइन टीथ का क्लीनिंग करके आपको सेट कर देंगे, फिर उसके बाद आप जा सकते हैं। आज ही हो पाएगा तो कर देंगे। मैं आपको दिखाता हूँ एक बार। हाँ का So look at that. You can see his slight asymmetry there, but more importantly, maxillary hyperplasia and chin was forwards. So we've corrected that. Chalo fir. Sara, we need to do.
Everyone, we are here at Richardsons Hospital with a patient post bi-jaw surgery. It's been a recovery for about 6 days or 7 days, 1 week for him. And he came from very far, literally the north of the country to the southernmost tip. And this is on the left, on his right, patient's right, is his pre-operative picture. This is how he looked before. Now when he came to us, he complained of almost concave face with a class 3 look, saying that mandible is projecting out or is protruding out. It is more prognatic than the maxilla. So this was how he looked on the profile view. थोड़ा सा आप आपके लेफ्ट पे टर्न हो, this is him now. So one look at him and we see that yes, the problem does lie with the mandible, but also this hollowing at the maxillary region. The upper lip is doesn't have support, it's falling back. Contrary to what we see now, where we see this fullness of the upper lip and it's much more in better proportional relation when seated on the lower lip. We'll have a look at this front view because there we can see the changes. थोड़ा सा सीधा देखो, आप खुद भी मिरर में देख सकते हो. There was hollowing. We can see that the upper lip did not have fullness. There was less of support. We see the grooving on both the sides, and we see now where the maxilla has been advanced and also the mandible to correct the bite and to correct the jaw discrepancy, the skeletal discrepancy. It's been a bi-jaw surgery for him because it has been a maxillary advancement and also a mandibular setback to get the, correct the concave facial profile, get the jaws in alignment, get the dental occlusion correct. This is his smiling picture. थोड़ा सा आप स्माइल कर सकते हो अभी. Yes, he is in pain and he feels this area is tight. So the problem lied, as I mentioned, was with the upper jaw and the lower jaw both. The upper jaw has been advanced and the lower jaw has been taken back such that the dental occlusion or the bite is correct and also the skeletal alignment is correct. Once again, we'll show you the side view or the profile picture for him, the profile view. Yes, that profile will be fine for him, where we see how the upper lip now rests on the lower one. The maxilla has been taken ahead. The chin looks more proportional to his face, the lower jaw is behind. So it's no longer a concave facial profile for this man now. It's been almost a week post his surgery. He's about to go home. We're looking forward to seeing your pictures after once all the healing subsides. Okay? Thank you.